My name is Leslie Playa, and I am the Executive Director of SAFE Project. Welcome to our Prevention Month webinar series. Today's presentation is Are We Numb to Rising Overdose Numbers? Systems Change for Driving Long-Term Transformation with Tracy Stefik and Alex Figueroa. If you want to, go ahead and put in the chat where you are logging in from. We're really, really grateful that you have chosen to spend some time with us today. Following today's webinar, you will receive an email with a link to the recording. Although this presentation does not qualify for continuing education credit, attendance certificates will be sent out in the next 2 weeks for those that have attended the live webinar. During the presentation, we ask that you provide your responses to reflection questions in the chat, while any questions you have should be submitted in the Q&A section. Before we get started, a little about SAFE Project, followed by the bios of our presenters. SAFE Project is a national 501c3 nonprofit committed to overcoming the addiction epidemic in the United States. Established in 2017 by Admiral James and Mary Winnefeld after the tragic loss of their 19-year-old son, Jonathan, due to an opioid overdose, SAFE Project aims to save lives impacted by substance use and mental health challenges through overdose prevention and response, education on stigma, and development of prevention and recovery programs. SAFE Project also provides tailored guidance and training within its 4 key initiatives: safe campuses, safe communities, safe workplaces, and safe veterans. To learn more, please visit safeproject.us. Now on to our presenters. As Senior Director leading the Safe Communities portfolio, Tracy Stefik is responsible for building national, state, and local partnerships that support communities in responding more resiliently to the impacts of substance use and overdose. Passionate about sustainable bottom-up solutions, Tracy brings nearly 20 years of experience working in local government and nonprofit organizations, executing various aspects of community policymaking and systems change. She joined SAFE Project in 2020 from the National Association of Counties, where she mobilized 3,000 counties and nearly 40,000 elected and appointed officials from across the United States around early childhood investments. Prior to that, she facilitated strategic cross-system planning and service integration initiatives for Fairfax County government in Virginia under the direction of the Deputy County Executive for Health and Human Services, and dedicated her early career to direct service work. Tracy holds a master's degree in public administration and a graduate certificate in local government management from Virginia Tech, where she is a member of the Pi Alpha Alpha Honor Society for Public Administration. She also possesses a Bachelor of Science degree in Human Development and Family Studies from Penn State and serves on multiple national, state, and community-based boards. Alex Figueroa is the Deputy Director, Safe Communities Portfolio with SAFE Project. Alex oversees SAFE Project's Bridging Prevention and Recovery, or BPR, program, an integrated forensic peer recovery specialists, or IFIPers, training series, a program for certified peer specialists who work with individuals that are justice involved across many settings, including probation, parole, corrections, treatment, and recovery. In addition, Alex's focus includes leading technical assistance efforts and regularly capturing progress to improve community outcomes and enhance organizational collaboration, strategy, and performance. Alex has a strong emphasis on community outreach with the intent to build long-lasting relationships and foster collaborations and partnerships amongst communities throughout the country. Alex's motivation to work with individuals, families, and communities impacted by substance use disorder stems from his own family's lived experience. He is originally from Buffalo, New York, but now resides in Bennington, Vermont. Alex attended Utica College, where he received a Bachelor's of Science degree in Health Sciences with a minor in gerontology, and Hilbert College, obtaining a master's degree of public administration with a focused concentration in health administration. Take it away, guys.
Thanks so much, Leslie, and thank you all for being here today. Before we get started, I just wanted to actually share with you guys a little bit of what we do at SAFE Project, or our Safe Communities portfolio. So Our primary objective is really to support communities in systemically reducing the impacts of substance use and mental health. And so we do that in a variety of ways. The first is we help communities through tailored technical assistance. And you can see in the slide here, there's a bunch of different ways that we do that. In some cases, it is group process facilitation. In some cases, it's community supportive outreach projects. Sometimes it's advocacy work. So that really varies by the community because our approach is really to meet communities where they are and support in the ways that they need the support. We also offer in-house evidence-based and evidence-informed programs that we've developed and tested ourselves. And we really try to focus the development around areas that we see nationally where there are gaps. And lastly, we create resources and tools available for the general public, just on any topic related to substance use and across the continuum of care. So I also wanted to share with you a few philosophies or our approach to working with communities. We work with state agencies and local communities, and that can include community-based organizations, coalitions, school administrators through our Safe Choices programs, health departments, harm reduction organizations. So we don't necessarily define the term community. And really our entire approach is about being a partner to you and collaborating alongside communities with an emphasis on those tailored bottom-up solutions, because we recognize that every community is different and you all are the true experts in your communities. So we're here to serve as a resource to you. For today, some objectives that we're hoping to hit on today. This webinar is going to focus on systems change. And while we hope to share a little bit around the definition of systems change and what that can look like in your community, we're also hoping to empower you all to bring systems change into your community, make that a reality. And also share some really great resources and tools for doing so. All right, so digging right in, wanted to talk a little bit about having a foundation. What is systems change and what are some definitions and key concepts? And so you'll see some of those on the screen. And so simply, systems change is really about understanding the different parts of a community, how they interact, and how they affect substance use outcomes. I really like to think of this as an eagle, and I use this metaphor a lot, that an eagle will fly up in the sky and it can see the entire forest and the entire ground above them or below them. And they're also able to zero down at the same time onto prey or something on the ground. So they're able to take a wide view while also still remaining grounded. And I really love that because I think it provides a lot of perspective and can easily help people visualize what systems change truly means. Really, it's a comprehensive approach, and the approach is really about addressing the underlying structures, policies, practices that are shaping around a particular issue. And in this case, we work in the behavioral health field. So in this case, mental health and substance use. So there's a lot of complexity when you're talking about environmental factors, social factors, economic factors. And so it's really about looking at all of that. So I'm hoping you're saying to yourself now, yeah, like that's a lot of what I do. And that's the point, is we might not refer to it as systems change work, but most of us are already doing systems change work. So anytime that you are working on multi-sectorial objectives, working on broad coalition membership work, that is all systems change work. Anytime that you've brought together health promotion agencies with law enforcement or with emergency response, these are their own complex systems. And they work on opposite ends of the continuum of care, meaning some are upstream, some are working downstream. And so that alone is systems change work. So it's not something that is or has to be overly complicated. I also wanted to take a moment to share a brief history about how we got to this and what systems change work has evolved into. And so our early understanding around substance use disorder was very much operating under the paradigm that it's a moral failing or that it's individual choice. And much of that placed an emphasis on treatment. That has since shifted to more of a public health perspective. And really that is because a lot of the scientific advances that we've made in psychology and neuroscience fields. Systems thinking really emerged in the late 20th century and has gained a lot more traction, not just in our field, but in many different fields. And so what's amazing about it is we're able to really apply a lot of these concepts to other fields. And since then, that the theory of systems change has really, again, shifted, and we have really brought that into applied practice. And a lot of that is because we've all become familiar with the strategy around collective impact. So we've seen a big paradigm shift in how we approach the complexity of substance use disorders, and really have been able to now place an emphasis on integration in order to have more holistic care systems, more collaborative systems, really lean into data-driven decisions, and be a lot more solutions focused and look towards the root cause of a problem in order to promote healthier communities overall. So I have a reflection question I just wanted to start out with, and that's really to hear from all of you about, I guess, how siloed are you feeling with your partners and your colleagues that work across the continuum of care in your community? And if you want, you can throw that in the chat. You can do an emoji thumbs up, an emoji thumbs down. Sometimes it's a little bit of both, but I'd love to just gauge how y'all are feeling about systems change work. Not good? Is it great? And while you guys do that, I think I wanted to talk a little bit about silos in general. And I think in this field, part of the challenge is that we have historically thought about this as an isolated health issue. And so there was a focus solely on addressing the immediate need for care in front of us, which would be addiction, and not traditionally the broader context of the issue, which might be poverty for some, might be trauma for some. So there's a lot of other different reasons behind them. Other ways that we've thought about this, it's really thinking about how economic status can impact our access to treatment. And so if we're only really looking at that need for treatment, we're not looking at any long-term solutions. We're not addressing risk and protective factors and prevention. We're not supporting recovery supports in order to sustain recovery. We're not supporting harm reduction strategies to mitigate the impacts. So these are really, I think, reasons why that this can be so important. And I'm seeing some of you say more is needed, right? More community-based services are needed. I see that a lot where you might be good within the community, but it's very siloed within your local or state governments, or local government is very siloed from the state government. And what trickles down from the state doesn't always connect, or does it trickle back up? Yeah, sometimes you're doing good to some degree, but not all of the partners are at the table. So thank you for sharing that, because I think as a whole, all around, that's how a lot of people feel. We could always do better. And I think that that's what is amazing about systems change, is that the intentionality is to be very inclusive, and it's an ever-going process, and it allows us to remain more reactive proactive to shifts that we see in our systems. So I wanted to talk a little bit about, oops, we are on the wrong way. The importance of systems change. And it really brings us to the question of, why does it seem like everyone is numb to these rising overdose numbers that we see? And I think that there's a lot of reasons for that. When you're working in this field, I think it's easy for a lot of us to feel like we've been screaming for so long, like change is needed, this is a problem, people are dying. But you're not getting the reaction that you kind of would hope. I think that this is because of a lot of reasons. So the first really is that we just have so many more systems than in our world today than we have had in the past. And we really do need people in the field that understand systems change, like all of you, that can help share that message across your communities. I also think that people especially feel very jaded by overdose numbers being reported in the news. And that's just really because we have access to so much more information so fast these days. And so I think that in ways it has sort of normalized it over time. It has created a sense of powerlessness, compassion fatigue in this field. There's a lot of resignation that the problem is too big to solve. A lot of emotional disconnection in order for us to protect ourselves to the compounding crises that we see. And so we talk about what's happening on an international scale, the COVID-19 pandemic. There's just all of these compounding issues. And I would also say that stigma just still exists in our field, and that's something we're always working towards. But there are a lot of things that we can do. And I do think that we are in a time right now where there's been a lot of attention placed on substance use and mental health. There's been an influx of resources, whether that is federal, state, local resources, through philanthropy, through opioid settlement funds. And I'm so passionate about this because I feel that it's a really important time to work on true transformation, true systems change, and work on things that are bigger challenges that maybe we have not prioritized in the past because we've put all of our resources to the immediate need in front of us. And it's not an either or, it's a both and. And so I hope that through this training, you feel a little bit empowered to work towards that transformational change and do things beyond just focusing on strengthening a program. It's really, what are some of these broader ones, like ensuring no wrong door systems. So if you come through prevention in the health department or harm reduction agency at a local community-based organization, the outcome is still going to be the same. So what kind of systems change work needs to happen so that people can have that kind of support and care? It also lets us be more adaptive and responsive. It enhances our community resilience. And a lot of times there's so many good benefits to system change, but what I will hear from a lot of people working in the field is like, okay, but I'm not a decision maker. I don't have a big fancy role. I don't have access to funding. So what can I do? And I would say that there's a lot that you can do. First is establishing your connections with some key stakeholders in the community. So you are already building a lot of really good relationships in the community, and you are a connector. So healthcare providers, local officials, these are people that you have access to, and you can help open doors for dialogue, and you have a lot of credibility already established with them. So engage with them in community meetings and forums and events, share your insights. That is very, that expertise is just, I think, it's so valuable, and whether you realize that or not. So really share that, cultivate these relationships. And the other thing is to follow up with your local decision makers. And I say that because a lot of times we work with them to get something done, but then they don't hear about it on the back end, about the wins and the great things that happen from that. Or the work that's still going on in the back end. So I would say keep that conversation going. Also, you can share a lot of the relevant data that you have access to, highlight the impact and the effectiveness of the interventions, share case studies, share best practices, share solutions, not just the problem. Communicate and celebrate your community's success. There's a lot of great things that happen, and even small wins build towards big wins. So I think being able to communicate our assets in our community, what makes your community great, whether that's a local library or your business, a specific business in your community, or a faith institution. There's a lot of really great assets in our community. So what makes your community so great? Sharing testimonials and support of individuals with lived experience. If you have lived experience, making sure you're at the table and helping bring others to the table as well. And then just leveraging your coalition or stakeholder group with a unified message in order to advocate for change, in order to make a case for a comprehensive approach, and really participate in different events that are continuing to raise awareness and build education. A good way to do that is even through leveraging social media. So if you haven't already, check out our No Shame Pledge, because we have a really great toolkit for doing that as well. So there's a lot of things that you can do that are within your own role, from the bottom up to shake things up and really begin to get people to unite around bigger systems change that can be really transformation, have a lot of transformation. So I want to stop there. I'm going to shift gears a little bit and I'm going to turn it over to my colleague, Alex. We spent the first part of this webinar really talking about what is system change and how you can bring that and make that what your role can be in that system change and some of those strategies. We now want to talk about, okay, but how do you put that into practice? How do you make that a reality? And what are some tools to be able to do that? So I'm going to turn it over to my colleague, Alex, to help with that.
Great. Thank you, Tracy, for setting the stage. And I apologize in advance, having some slight technical difficulties, so my camera's not working, but that is okay. So for this, we're going to just have a little bit of fun and have a thinking exercise. And so, first question I want to pose, if you want to write it on a piece of paper, most certainly do that. But definitely encourage you to enter your responses in the chat. Number one, what are three key problems that you see in your current system? Whether it's, your own community, just maybe your own experience, what are three key problems that you see in your current system? And then feel free to enter it in the chat. Great. Silos engagement, follow through. Silos, yeah, great. Thank you, Lori. Not enough effective use of MAT. Lack of information education. Well, these are all really good. Yeah, stigma surrounding addiction and recovery and lack of education. One is definitely a lack of communication, stigma around MAT. Okay. All right. Anybody else? Okay. So for the next question, what are two specific impacts based on your responses? So what are two specific impacts these problems have on individuals in your community? So I see Lisa, too much repeated inpatient treatment. Okay. Yeah. Repeated services. Ingrid, that's a really good one. Inability to make informed decision about care. Development of programs that can help, but there's not enough communication, then the programs are suspended or canceled due to lack of engagement. Okay. Not knowing where to start regarding care. Right. Okay. Affordability of treatment, right? I mean, yeah, depending on the type of treatment, right? Whether it's inpatient versus outpatient. And obviously what type of insurance you might have. I know those are often some key impacts. Okay. Now, based on your responses, what would be one idea for a systems change that could address the issue? So what is, based on your response, what is one idea for systems change that could address the issue? In some examples, it could be, implementing a trauma-informed approach, integrated mental health services. One of the things that I think of when we talk about systems change is developing a data sharing platform to track trends. I know that's often a barrier in our line of work, particularly around HIPAA laws and particularly around SED and treatment with 42 CFR Part 2. Now that plays a role. Let's see. affordability and treatment, access to MAT, community and population. These are really good responses. More open communication between agencies. That's good. Anyone else? More healthcare provider education. Education on different types of treatment. Yeah. These are really good. Now, taking the responses that you've developed, how do we make, your plan a reality, right? I think the idea is, taking these ideas and then how do we move forward? And so I pose another question, what's your big vision for your community, that you work in? Um, I know in the chat, stigma had come up a lot, right? I know, how do we become a community free from stigma that exists, right, around people who use drugs or people that are in recovery? Um, Disparities, right? Based upon it could be different circumstances, identified, thinking about, just community around just obviously it could be youth. I think Maureen, I know you've talked about youth at this in this webinar. What are what's your big vision for your community? Let's see, education or recognition about what programs are doing is helpful. Well, while you're thinking, pose another question. What are common obstacles to systems change in your community, and what are some strategies that you can take to overcome? Right. So, examples is establishing trust. Oftentimes when we do talk about systems change, relationships is something that comes up, but really trust is a part of that. So, how do you establish trust? How do we be more adaptable and responsive to these shifts, right? Tracy talked about the paradigm and how things have changed over time. Having sufficient data. And lastly, the diversity of stakeholders at the table. And I'll speak from the peer recovery lens, that is one thing that's very common, is that lived experience is often missing when we're talking about like systems change. So, how do we get people at the table, at the seat of the table that have that lived experience and be able to share their stories? Does anyone have any thoughts on that? And really lastly, can you identify a community champion to support? Or maybe you are a community champion and how do you support others around you to move things forward, whether it's, could be housing, right? Transportation, working with elected officials, could be libraries, working with the faith communities. Chamber of Commerce, I know often um, comes up and, how can you collaborate with Chamber of Commerce? Not just having people in recovery at the table, it's about making sure all.
Oh, Alex, I think I might have lost you.
Can you hear me
Something
now?
just,
Yeah.
something just happened with your audio, so just be aware. Mhm.
Thank you. Angela, I utilize people in recovery as speakers at events that come with ideas on change. Yep. In my community, in particular, faith communities are important, so promoting open communication and open mind in those spaces. Okay. Really good. What are some great connection points, right? When we talk about when we talk about identifying community champions, we talk often about building bridges. What are any other examples of I see recovery is different for each person, so what is good for one may not be good for other. Yep. Yeah, these are really good. Yeah, so when we talk about making, you know, system change a reality, right? I want to just kind of point out the importance, right, of just collaboration. Individuals, system change, can be often siloed. So the importance of really coming together, bringing people together. Um, just I just love the response. Yeah, this is good. Okay.
And Alex, if I can jump
Go
in,
ahead.
I think when we talk about how to make this a reality, because we all can see a lot of what's working well and what's not working well, but you have a lot of knowledge that other folks that necessarily don't. So how do you meet those people with some of their perspective, some of the messaging that would be most interesting to them? So I think it goes back to what is your big vision for the community, because we all kind of share that. We all can very much agree on some of these very basic principles and then work from there. Of course, we're going to have differing perspectives, and that's okay. But being able to start from that place and work towards identifying, okay, what are some of the bricks that I need to build in order to build this bridge? And that could be like you're establishing trust. Maybe that is the data component. And then now looking towards, okay, I have to make my pathway on that bridge to bring these two buildings together. And who are people in my community? Who are my community champions that can help me make that pathway to create that bridge? So I really just love the visual here, because I think it helps um, think about all the different components that would, that bring some of this to reality.
Good. Thank you, Tracy. All right. Well, one of the kind of shift a little bit. So one of the programs I want to introduce that we offer at SAFE, it's called Bridging Prevention and Recovery. And so before I talk about we also call it BPR. I do want to say it's really what I'm about to provide is just very high level. And so most certainly you can reach out to me after the webinar. We can talk in detail more about BPR. But really what BPR it's focused on integrating prevention through recovery. It's an evidence-based training and technical assistance program that we help provide community-based partners kind of a step-by-step process on how do we facilitate sustainable integration of traditional siloed approaches, right? As mentioned, like historically, a lot of prevention and recovery have been siloed in their own field, and oftentimes and not just that, but also treatment and harm reduction, but particularly for BPR, the goal is to really replicate a process of a working of both fields working together in the long term. And so for BPR, it's a training that's 3.5 days followed by 6 offered technical assistance support. And through that, we go over different goals. We really hit on the critical foundations of, like, we talk about health equity, communication, leadership, etc. Um, the model that we created is really built upon the strategic prevention framework, and but this, it integrates the aspects of recovery. And lastly, and we really provide strategies for creating an effective pitch. Whether it's trying to identifying funding resources, there's an educational component around data. And, how to identify priorities when everyone has a different priority, right? So that's really kind of high level overview of BPR. This is very hands-on. We really, our goal with BPR is for each participant to leave with an identified goal. And we support folks just by, again, providing technical assistance, um, to, again, looking at sustainability, funding, barriers, planning, and whatever the need is within that community. Some of the things that we learned through our pilot programs and work with other communities. It's centered around community, right? And it's developed by people in recovery at the forefront, and feedback from the community and higher education professionals. They really provided good feedback, right, on just the importance of being centered around community and really having that lived experience and voice. So if anybody's again interested in BPR and training, I mean, definitely reach out to me. We do provide extensive support. We have a manual, we have a pre and post test evaluation. Again, very learning collaborative opportunities for peer-to-peer learning. A lot of hands-on training and worksheets. And so, again, if anyone's interested, just let me know. We are holding a training in early 2025. So definitely, we strongly suggest you go through the training prior to the TOT if you're interested. And so, yeah, we can happy to bring this to your area, or if you have a coalition or organization or even state agency that's interested in possibly doing this, yeah, reach out to us, and we're happy to support.
Thanks, Alex. I love BPR because it is so hands-on. It works from a model and a framework as far as the systems integration goes. We talk about prevention and recovery, but really it's about integrating the entire continuum of care, and allows communities to do it in a uniformed way while also doing it in their own way, right? So being able to identify their own goals and work towards those goals. And that's really what the technical assistance is around. So if your community is looking for any support in systems integration, BPR is a good way to be able to do that and bring that curriculum to your community. The other thing we wanted to share with you today to support some of your systems change work is around the community playbook and safe solutions. The community playbook is a very high level blueprint that helps communities build collaborative and effective approaches to address substance use impacts. It is free. You can download it right off our webpage. And there's a community pulse survey to really allow you to get the pulse of your community and what's happening from the general public and other folks outside of your space. Also, there's a community resources exercise included as well. So it allows you to evaluate, okay, what resources do we have? What's the capacity that we have? So we can identify what those gaps are and what's missing. And so all of these things will allow you to help understand some of the perspectives of the folks living in your community, because it's not just about the quantitative and the data driven. There's a lot of value in the qualitative data that we receive from our community as well in order to implement some best practices. And so the community playbook is very high level. I would say if you're just kind of starting out in your community, it's a good entry point. BPR is definitely going to be a lot more hands-on with our support. And then the other thing I wanted to share with you today is Safe Solutions. So our Safe Solutions platform is completely free. It is user-driven, and it's very much like a wiki or Wikipedia platform. It is not something that is open to the public, however, like Wikipedia, and it serves as a functional collection of research, policies, educational materials, resources, promising practices, all of the great things that are already out there combined into one platform. And there's about 80 different strategies on this platform to support your community in your strategic response efforts. So I think what's amazing about the platform is that some of these solutions might not be applicable for your community and some might be, but it really brings together a lot of the great resources that are out there in a way that's vetted. We are constantly updating it, leveraging some subject matter expertise that we have with some partners, and making sure that we're bringing community professionals like you, all of the really great resources, so that you can really spend time just doing what you know is important, what you want to be doing, which is actually helping and supporting people on the ground. So yeah, it's ever growing. So I would encourage you to keep checking it out. We're looking to actually add some additional strategies as we move into 2025. It's also a really great thing for a community leader. And so we talk about who else can be your champions, right? Elected officials, libraries, Chamber of Commerce. These are people that you want to fold into the work we know are really important champions, and also need to implement different supports within their own sectors. And the information in here is balanced in a way that can provide that education and knowledge around a particular strategy for folks that are maybe not a subject matter expert in the field like all of you are. And so I hope that you can use some of the information that's in there to support you in that way, to help dive deeper and drive some of your work in your coalition, or even support you as you're writing up different grants and things as well. If you have any questions, please don't hesitate to reach out to Alex or I. There is a technical assistance request form, which is up here. And so if you're looking for very specific support and we can help you in any way, just click that button and we'll it asks a few questions, and that comes directly to us so we can get in contact with you right away. Also, the importance of this is that it is peer-to-peer learning, and you all have done some really great work, and we know that because we've seen things trending in the right direction. So if there's any promising practices that you're aware of that are not reflected on any of the strategies in particular, then definitely share those with me, and we will make sure that they get uploaded, because there's a lot that we can learn from each other, and supporting each other as we implement different strategies is really the most effective way to do this. The other thing I want to share too is we have some tangible actions that are coming soon and being added onto this platform. And I call them tangible actions because a lot of folks will say to us, okay, but what can I do personally? And so, yes, these are a lot of strategies that are systems change strategies that you can work with on your coalition, bigger collective impact strategies. But we will be adding a drop down to this platform that has very tangible things that people can do within their own spaces and environments. So we'll have a real broad base of things for the faith community. We have different ideas for libraries, workplaces, transportation, institutions of higher education, youth. So there's a lot of really great ideas that are coming that you'll be able to also share as flyers and information with those counterparts in your community so that you can share with them different things that can be different supports that can be integrated within their own environments to support people that are in recovery or people that people who use drugs. We are approaching some time where I can take some Q&A if there's any questions as it relates to system change or any of the resources that we have. And so feel free to throw them out into the Q&A or into the chat as well. Maureen, I see that you're asking, are the services feasible for small nonprofits? Absolutely. We are a small nonprofit ourselves. We work nationally, but we work with communities of all sizes, rural, urban, suburban, big, large, all over the United States. And I've worked with a lot of different communities of all sizes throughout my career. And we don't, if cost is a barrier, we certainly will work with you. A lot of our resources like this platform itself is also free. So there's a lot of great things that are already on our site that are free, and we can certainly help provide guidance and coaching and support around all of that, and then beyond as well. So if there's any other questions, we'll take them. I just wanted to pause, take one, and let's see, Alex, if you had any additional things you wanted to add before we wrap up and share some key takeaways from the webinar.
Nope, nothing on my end. Just thank everybody for having just being very engaged, and appreciate all your responses. So thank you.
Yeah, thank you very much. So overall, system change is just a very transformational process. And I think that if anything, I hope that that's a takeaway that you get from today. It helps us create a more holistic approach and examine some of our underlying norms and our structures and policies that really contribute to some of the challenges that we see in the community that are beyond surface level. It can help to create such a fundamental shift in how communities understand and address issues around substance use, and it allows for those solutions to ultimately be more sustainable, more long-lasting. It helps to really emphasize collaboration, and that collaboration among diverse stakeholders, and places such an emphasis on preventative measures and solutions. So we're not just treating those symptoms like we were talking about earlier. So I hope that you are able to take some of that away. And finally, I think the systems change work can really help us all because it helps us to prioritize some of the voices of community members, and empowers individuals to take an active role in shaping solutions in their own communities, so that they are just overall more inclusive and more compassionate. So by really addressing the root causes, fostering the collaboration, empowering individuals, system change overall can really just help us all create a more equitable and healthier environment for everyone. And so that's really what I would like to leave you with today. If there's no additional questions, which I don't see. And really just know that this transformational change is very possible in your community. And just also know that our team, Alex and I, but also our entire SAFE Project team, we're here to support you in your journey along the way. So please reach out to us at any time. Our contact information is right there on the slide. And I just want to thank you all for joining and being engaged, because I know it's so hard to take an hour out of your very busy days to join a live webinar. So with that, I'll turn it over to you, Leslie.
Thank you so much, Tracy. Thank you to you and Alex for all of your work on this. We really, really appreciate it. Just checking the chat one more time to see if there are any last minute questions. People asked earlier about the slide deck, so we'll share the PDF version of the slides along with the recording post webinar. So, okay. Looks like we don't have any more questions. So thank you all so much. Hope you have a wonderful rest of your day.